Welcome to Your Health, your television and online source for veteran medical and health information from the Phoenix VA healthcare system. I'm your host, Paul Coupeau, and today we're going to find out how the Phoenix VA is taking a proactive approach when it comes to health promotion and disease prevention. Then our veteran volunteer field reporter, Christian Normandy, will check in with the Phoenix VA's supervisory recreational therapist, Lynn Hamble, to show us how to use a new and inexpensive muscle building tool. Technology is helping make it easier than ever for vets to learn about their health issues. Victoria Reyes is the My Healthy Vet coordinator here in the Phoenix VA healthcare system. Victoria took time to meet with us about how My Healthy Vet is helping to improve both veteran understanding of their health issues and provide a gateway to veteran and active duty personnel's health records. Thanks for being with us today.
Thank you, Paul.
What is My Healthy Vet?
Well, My Healthy Vet is the electronic personal health record for veterans. It is under the va.gov. It is a site that is online, and that is a way that veterans can access their medical information and pretty much to take charge of their health.
Now, I've heard that there are different levels of the My Healthy Vet website and that there are portions that are available for the general public. How can the general public use this?
Well, once they go to the website, from there they can just navigate through it, and there's excellent resources, everything from a medical library to even requesting a DD-214 online. As a family member looking for information of how they can better assist their veteran too.
Okay. Well, I'm a veteran. So just as an example, how could I initially make use of My Healthy Vet?
Well, we want to make sure that you registered and that you registered as a VA patient. By registering as a VA patient, then you're connected to your chart. And that's what we call the advanced tier. But we want our veterans to get to the premium tier, and that will allow them more information off their medical records. And by doing that, Paul, then what I need you and our veterans to come in and register online first, or here at the library, which we have, but come in and show us your ID and fill out the form. And once that form has been filled out, then we can connect you and you've been authenticated, or as they also call it, the premium account.
Okay. What kind of benefit does the premium account offer?
The premium account offers a lot. Everything from refilling your prescriptions online to getting your labs online, wellness reminders, appointments to help you to stay on track, using secure messaging, which is a non-urgent, non-critical way to communicate, but also what we call the blue button, download my data. So that's really going to save you some time, because you won't need to even come into the VA facility, our VA here, to request or to review your last labs or your appointment dates, again, or radiology information. So it's much more detailed.
Okay. Let's go back to the secure messaging that you mentioned. What kind of benefit does that provide for the veteran?
Well, that's communication. Another access of communication. So for example, instead of using telephone or walking in or trying to find a parking, you can just go ahead and send us a message in secure messaging. Again, non-urgent, non-critical way to communicate. And we also let our veterans know that we have 3 business days to reply back. But our teams are very good about doing, replying back sooner. But by sending a message, like for example, your appointments, or maybe you need a medication refill, again, that saves you from using telephone or not coming, or walking in. So it's another access to keep better care of yourself.
You mentioned the blue button. What's behind this? What can veterans benefit from this?
Well, the blue button is a program. In My Healthy Vet, what it does, it draws all your information into one area. So, for example, if you wanted to go back historically to some of your information, everything from coming into the VA, if you were hospitalized, for example, to your radiology information or EKG notes as well, so you would have that information.
Well, this sounds like a wonderful way that technology is really helping our veterans get their health care. Thanks for coming in and telling us about it today.
You're welcome, and thank you again for this opportunity to share.
Next up, our Army veteran volunteer reporter Christian Normandy meets with recreational therapist Lynn Hamble to show how you can get a great strength workout with a minimum financial investment.
America's service members and veterans are strong, forged out of bravery, sacrifice, and duty. From all corners of the country, a family for life. But whether they served in lands far away or communities close to home, some of these men and women may face difficult times or even crisis. But sometimes reaching out for help can be the most challenging and worthwhile mission of all. Thankfully, friends, family, and communities are standing by their service members and veterans now more than ever. We're all in this together. When you recognize something isn't right, make the call to the Veterans Crisis Line or Military Crisis Line. During times of crisis, reach out and call. Dial 1-800-273-8255 and press 1.
All right, Lynn, tell us about the resistance bands, what the different colors mean, what the best uses for them are, and just tell us a little bit about them.
Okay, well, we have 3 different color resistance bands. They come in other colors, but these are just the 3 of them. These are all latex-free. The yellow's a light resistance, the red's a medium, and the green is a heavy resistance. So they have different textures and different thicknesses for the resistance level.
Okay.
You would use these you can use these for exercising. You can exercise your entire body with one of these.
Okay.
And they're really nice because when you do resistance training or strength training, it's an alternative to having to go out and buy weights or to join a gym. You can work out with one of these at home or on the road or wherever you want to go.
Mm-hmm. They're easy to pack.
They are very easy to pack. They're very lightweight.
And you can do a lot of different exercises with them?
You can.
Okay.
Would you like to see some?
I would love to see some, yes.
Okay. So the first thing is I'll show you. I'll let you have the green because you're stronger than me.
All right.
Is how you hold it is you would wrap it in your hand like this.
Okay.
So you can make it shorter or longer.
Okay.
So if you want to work out your biceps, which is your arm muscle, you can put it under 1 foot or 2 feet.
Okay.
Now you would make it longer or shorter depending on how strong you were.
Okay.
So if you're pretty strong, you can make it shorter. So bending it like this feels like about a 7-pound weight to me. What does yours feel like?
10.
Okay. So if that's too light for you, you can make it shorter.
Just wrap down.
Yeah,
down.
yeah. So it allows
Keep
you
the
to have
same
different
form.
resistances, yeah.
Okay.
So there's 3 different levels when you do this. The one level is 1 arm at a time.
Okay.
And of course, you're going to tuck in your stomach and activate your core.
All
Thank
right.
you. 2 arms together. And the highest level is alternating.
Okay.
Alternating, and the reason being is when you alternate, you have to activate your core or you're going to sway your spine.
Okay.
So your spine wasn't meant to move like that.
Okay.
So you would do right, left, but keeping that stomach tight so that there's no movement. And you can do this sitting in a chair or standing up,
Okay.
whatever you're comfortable with. So that's the biceps. Now to work the triceps muscle, which is the muscle behind the arm, it also houses a lot of fat, so people like to work that.
Right.
Is you hold it in the middle, hold it with your left hand in the middle, and then put your hand in the middle of your chest.
Okay.
And you can grab it once resistance or 2.
Okay.
And then you take your right hand up here and you just press straight down. Feel that?
Should I keep my elbow close into my side?
Yeah, just keep
or-
it straight. Just extend your elbow straight down. There you go.
Okay.
Feel that in the biceps?
Yep.
Yeah.
Tricep.
Normally, your triceps, normally you would do 2 sets of 20 repetitions. Somewhere around 13 or 14, you should feel some resistance back there.
Okay. Now, if you want to make this harder, you just choke up as
You can
opposed
choke
to
up,
wrapping.
yes.
Okay.
You can choke up. You can also do different things where you can come halfway down and hold it,
Okay.
all the way down and hold it all the way, and little pulses.
Oh, yeah. Okay.
Yeah, you see how that's a little different?
Yes.
And you can come halfway up. So you can really play around with your tempos to make it more difficult.
Okay.
Because as your muscles get stronger, this is going to feel weaker. So then you can hold it. And
Do different variations of the exercise, are they beneficial for different types of people that are trying to have different goals, or do you just want to do different?
it's just different things to work the muscle a little differently.
Okay, okay.
So whatever works for you.
Okay.
So then you can work out. That's the biceps. Let's work out the chest. Put it underneath your arms, under your armpits. You never want to put it around your neck. So you'd wrap it in, and just like you were doing a bench press or a weight machine, you could just come straight out. Chest is a pretty big muscle, so sometimes coming out, halfway in, and back really works it. So you can move it really slow.
Okay.
You can also do this to music. We do it a lot to music. It makes it more fun. There you go. Now bend your arms up like this. Let's do some flies.
Okay.
Yeah.
Yeah, I can feel that.
And you can actually hold it in. There you go. Very good.
All right.
Now to work the back muscles, you ever shoot a bow and arrow?
I have.
Okay. So you're going to hold this out like you're going to shoot an arrow.
So about in the middle. Is that
Yeah,
what we got? Okay.
yeah, yeah. And then grab it and pull back and squeeze your shoulder blades together. So there you go. So
Oh,
you
yeah,
should
I
actually
felt
see the
that.
shoulder blades.
Yeah.
Yeah. And you could hold this, hold it for like 3 seconds. There you go. And then release it. And then come back and do it again.
Okay.
Okay. So we just worked your arms, we just worked your chest, we just worked your back. Okay, you ready to work out your legs?
Absolutely.
Okay, so we're going to use a chair.
Okay.
So have a seat. Okay, take the band and put it underneath your foot. You want to make sure you get it underneath the middle of the foot so it doesn't snap you.
Okay.
Sit back, bend your knee up, bring it up as high as you can get it. Now make your band shorter. Grab it down, grab it down. There you go.
Right there?
Okay, yeah. Sit back and now kick out. Okay, come halfway up, bring it out. So you're coming up and out.
Like
There you
that?
go. Just like a leg press. Press it out.
Okay.
So you're pressing. There you go. Okay, the legs is a strong muscle, so sometimes going halfway is a good workout.
Okay.
And there's a whole bunch of exercises online. TheraBandAcademy.com.
Okay.
It's a very good website.
All right. And where can you pick up a set of these resistant bands?
You can pick them up anywhere where they sell fitness equipment or fitness supplies, sporting goods stores, fitness supply stores, department stores, Target, Walmart, Kmart, stores like that.
So they're easy to get.
They are very easy to get.
Great. Thank you very much, Lynn.
You're welcome.
Hello, I'm Sharon Hellman, Director of the Phoenix VA Healthcare System. Did you know that a simple thank you often means more to most veterans than any other reward? Some veterans have served during times of war, others served in peace. Some took time off work to serve, but many made it their career. Some veterans returned unscathed, but many bear painful physical and emotional reminders of the sacrifices that they made during their service. Regardless, all of our nation's veterans have earned our highest gratitude. We are ever faithful to our sincere oath to care for our veterans and to afford to them the full array of the high-quality health care to which they are entitled. Saying thank you is important, but there's always more that we the people can do for those whose dedication and service have helped preserve our heritage of freedom. To those currently serving in our armed forces, we want you to know that the Phoenix VA healthcare system will be here to provide you with the highest quality health care after you leave service. We thank you and look forward to serving your healthcare needs.
Up after the break, we'll introduce you to a fellow vet and learn about his experiences both overseas and back here at home.
From providing care
I served in the United States Army Nurse Corps.
to serving near the front lines,
I was the first woman ever to deploy on a Strategic Air Command deployment.
military women have served in many roles while paving the way for others.
I lobbied for women to be on board submarines.
The veterans benefits you earned honor that service and can help with challenges you face on the home front. From job training to disability compensation to buying a home with a VA guaranteed home loan.
I'll be able to change my career and make more money and provide a better life for my family.
Find out more about your eligibility, including how to apply online using e-benefits.
I'm proud to be an Army Reserve veteran. My mission now is to help women with military service learn about their veterans' benefits.
Achieve your next mission. Learn about and apply for your VA benefits today.
My name is Timothy Frank Hernandez. I was in the United States Army. I was a 19 Delta Cav Scout. What a 19 Delta is the eyes and the ears of the United States Army. We go out in front of enemy lines and we get information, anything that we can get from size of the units to you know, just what's going on. Because scouts, they go out before anybody else. We're out there doing a recon and kind of got stumbled on and a little bit of a firefight broke out. When we first realized contact, it's almost a shock at first. I mean, you know, it's one of those times when it was in the beginning, you're not really battle hard yet. You just you got out there, you're not really expecting everybody to fight you back, but the reality hit in when everything started happening, and it was a full-blown, you know, fight. Actions on contact and calling back up on the radio. The realization at first was hard. You know, you kind of want to hunker down at first, but then you realize this is my job, this is what I'm here to do, this is what I trained for all these years, and then you get up and you make things happen. I remember returning fire and thinking to myself, not thinking that, oh man, I'm about to die. More of what I was thinking was, if I die, my wife's going to kill me. I joined the military, thinking that it would at least help me out with school and get me a house. I never thought about my attitude or if I had one at all. But once I joined, I realized I did, and I'll tell you what, it made me into a man. It really did. All the experiences that it gave me, the leadership, the counseling, the mentoring, the camaraderie. It's everything about it just helped me out. It made me the man that I am today, and I'm proud of it, and I'm proud to serve my country. I had problems with my leg and my hip and my back, and I have some scars on my face and my frontal lobe. I had some severe head trauma. When I got to the VA, when I got out of the service, I came here. They got me the pay that I was due. They helped me out with my leg, and I go on a basis to go get looked at and get cared for, and when I'm in pain, they're here for me, Phoenix VA is an awesome place, and I really do love everything they said. I love everything about them. I really do.
We're honored to have Sharon Hellman, the director of the Phoenix VA healthcare system, with us today, talking about improving access to healthcare for veterans. Thanks for being with us.
You're welcome.
I've heard about community-based outpatient clinics. What can you tell us about these?
The neat thing about community-based outpatient clinics is we've listened to veterans, and so we pushed our healthcare out to where they reside. And so the difference of it is we have wraparound services that are primarily for outpatient, and then we have the actual hospital setting for inpatients and specialty care. So for an outpatient clinic, we have everything from primary care, mental health services, to even eye and hearing and dental, even to ensuring that women veterans get all the services that they need in outpatient clinic settings.
Wow, it sounds like those are very comprehensive in and of themselves. What sets them apart from what a veteran may receive as far as care at the main facility?
So the main facility is going to have everything from surgery to kind of like the specialty programs, oncology, dermatology, all the specialty care areas, as well as our inpatients. So when we have our emergency department here at the hospital, all of our inpatients wrap around those services, and that includes mental health treatment services as well. So the outpatient setting has all the wraparound services for our outpatients, and then the hospital, downtown Phoenix, has all of the primarily inpatient and specialty care programs.
Well, I can see where having those outpatient clinics out in the community would be great, time savings for a lot of the veterans. I know a lot of veterans now coming back, the younger guys and women from, Enduring Freedom and Iraqi Freedom, and their technology, they're young kids, and they are looking for new ways to access their health care as well. I've heard about telehealth. Yes. What can you tell me about that?
Well, and it's exactly what you said. we've listened to our veterans, and so we have pushed telehealth, our technology, so that wherever the veteran wants to go, we're able to kind of like camera to camera provide care. So we do this in teledermatology. We do it in telemental health. We are pushing out now teleretinal, especially for our veterans who are diabetics. We have to kind of do an eye exam just to make sure that they're doing okay. Well, we can do that now by a camera, and then we shoot the picture, have a specialist review that, so that they don't have to come all the way into the hospital for those specialty care services. And we're really going to see a lot more of that in the coming future, is how they probably will even be doing it with an iPad in the future. But telehealth is really the wave of the future where we need to go, so that our men and women who have served can actually just access their care or their provider when they need it. And that includes like My Healthy Vet, where we actually have secure messaging so that a veteran can actually talk to that patient-aligned care team, the team that's managing their care. They do that all by email back and forth, and it's a secure site that they're able to do it. So we're listening to the men and women who want these kind of features in their health care, and being able to have their treatment plan done when they want it, not when we think it's convenient for them.
Outstanding. There's a lot of exciting things happening, and I look forward to having my online appointments here in the future too. Thanks for being with us today, and thanks for talking about all of the exciting things happening here at the VA.
Thank you.
As a National Guard or Reserve member, you served your country. Now let VA serve you.
I wouldn't be here today as a successful woman without the help that I received.
Your VA honors your service by providing a wide range of veterans benefits. From home loans to job training, VA benefits can help with some of life's toughest challenges.
What's important about VA benefits is they don't just touch you as an individual. They can touch your parents, maybe your grandparents, your child.
Go to benefits.va.gov/Guard Reserve to learn more, including how to apply online using e-benefits.
I just finished a master's degree recently, and now I'm working on another degree as well. So the military made that all possible. My veterans benefits made that all possible.
No matter what the time is, apply for your benefits. You earn them. VA is ready to help you.
Achieve your next mission. Learn about and apply for your VA benefits today.
Welcome back. Quinoa. Not easy to say, but quinoa is a delicious and easy to prepare healthy side dish that's one of Chef Greg's specialties. We're welcoming back Chef Greg Gonzalez from the Phoenix VA Healthcare System to tell us about quinoa. Welcome back, Greg.
Thank you. All right, so what we're going to do is I'm going to show you a dish using a whole grain called quinoa. This is some that I have that's uncooked. Basically, it's 2 to 1. So you'd use 1 part quinoa and 2 parts water.
Okay.
You bring your water to a boil. You can season it, reduce it to a simmer, add your quinoa, and it takes about 15-20 minutes.
Okay. Well, in the interest of time, we've got some already prepared.
That's right. So this is what it kind of looks like after you've cooked it. So for this particular dish, we're going to add some fresh diced tomatoes, about a 1/4 cup diced onions, and half an avocado that I've already diced.
Okay.
And for seasonings, we're going to add a little bit of cumin, give it a little heat.
Nice.
A little bit more heat, but in a different direction, some black pepper.
Okay.
A little cumin. That's your Southwest flavor, along with some chili powder. And a little bit of salt. And last but not least, some lemon juice. And just drizzle that all over. All right, now we'll just fold all these ingredients together.
Okay. What can you tell me about quinoa?
It's a good vegetable source of protein.
Mm-hmm.
It's got great flavor. It's got a really nice texture that I enjoy. You can serve it hot or cold. It can be used in cereals. Traditionally, I think most people serve it as a side starch dish, but you certainly can use it as a main ingredient for a vegetarian dish.
Oh, okay, good.
So now we have our plate. We'll just take the quinoa and put it in the center of the plate.
And what would an average serving size be?
3 ounces.
Okay.
That's what you would want to serve on this particular dish.
Well, it looks really, really good. Thanks for coming in and showing us how to make it.
My pleasure. Thank you, Paul.
Thanks. For more information about this recipe and other healthy eating choices, come to the Phoenix VA website at www.phoenix.va.gov. Scroll to the bottom of the page and select Resources, then click on Newsroom and Healthy Living.
Here's to the military, past and present, who honorably serve but are so much more. Here's to the moms and dads, the grandmas and grandpas. Here's to the athletes, the adventurous, the determined. Here's to those who have better things to do than worry about their benefits, because now there's e-benefits where you can easily access and track all your VA and DoD benefits online, all in one place. Register for your free account today at ebenefits.va.gov. Then get back out there.
The Phoenix VA healthcare system is working to be a model of health promotion and disease prevention for the rest of the country. Our Health Promotion and Disease Prevention Program Manager is registered nurse Karen White. Karen and her team are working hard to transform the Phoenix VA's approach to healthcare. Welcome. Thanks for coming in today.
Thanks, Paul.
You're part of a group that is transforming the way primary medical care is carried out here. What can you tell me about it?
Yeah, we're trying to, it's a cultural transformation.
Mm-hmm.
The way medicine is delivered in the United States, it's reactive. You have to have a problem. Right. It's sporadic. It's only when you start having symptoms or you come in, and it's a lot about diagnosing. Well, what we want to do is be proactive. How can we keep you healthier? What can we do to keep you from having diabetes or worried about that? So it's more focused on the veteran, their unique situation, what's important to them, and then how can we help them make healthier choices.
Okay, that definitely makes sense. I mean, if you're living a healthier life, hopefully you won't have to come into the doctor as often.
Exactly.
What are you doing to try and increase awareness for this?
Well, my position, we actually have a full committee, Health Promotion Disease Prevention Committee. So we have representatives from all over the hospital. And then we also have national directives. But what we do is try to find opportunities for veterans, change the way providers talk to patients. It's not just telling them, take your medication. It's explaining to them the difference and asking them about their unique situations. Right. You know, what are the barriers? What is it that's really scaring you? What can we talk about? And to work out ways to meet their goals. Some of the things that we've tried to do here is we have a small produce market, for example, on Thursday afternoons. It gives us an opportunity to talk to veterans about healthier choices on their, with their eating, fresh fruits and vegetables, how they can prepare them. And it's not just in a weight loss capacity, it can be for any veteran walking through. We also have a Bountiful Baskets program because we're trying to get our employees to live better and be better role models and to get the same kinds of benefits that our veterans are getting from living healthier. We've got yoga classes for both staff and the veterans. We started a boot camp for our staff after work. We're doing things in our gym. Our director opened the gym for use by veterans and staff. So we're trying to incorporate and provide them some opportunities to make some better choices.
Definitely good. Well, I know this is a new program, so how's it going so far?
Really good. For example, our produce market and Bountiful Baskets, we won an award from a produce organization.
Congratulations, that's awesome.
Thank you. That was this year, and it was awarded to us actually last month in San Francisco as one of the public health initiatives. We were selected. Some of the other things, we've had really good feedback on the boot camps and the yoga. We're expanding that. It started out one day for veterans. It's now 2 days for veterans and 2 days, separate days for staff. We're trying to find increasing opportunities. We have a 2K walk we did last year, and it's coming up on the 15th of May. Veterans and staff can walk in Steel Indian School Park, which is right across the street. It's in the morning at 6:30 to 9:30, anytime between there. It takes about 25 minutes to walk it. And what we're doing is raising water, bottles of water for our homeless veterans.
Oh, that's outstanding. I mean, that helps everybody across the board.
Right, starts our water drive for the summer. And it gets people outside and doing something active.
It sounds like this is a really beneficial program for veterans and staff. Where can we find out more information about it?
Well, we do post some of the information on our internet sites, but they can also contact me at our main number, and my extension is 5511 if they have any questions.
Good deal. Thanks for coming in and telling us about
Thanks,
this.
Paul.
Appreciate it. That's a wrap for another episode of To Your Health. Remember, you can find more information about the topics in today's show by going online to the Phoenix VA Healthcare System website at phoenix.va.gov. I'm Paul Coupeau. Thanks for watching.